Welcome to our deep dive. Um, you're looking into hospital safety, right?
Yeah.
And especially for older adults.
Yeah.
And you've got some great sources to work with.
Yeah, we do.
From AHRQ.
Yes.
That's the Agency for Healthcare Research and Quality, and HealthWise. We're talking 10 patient safety tips for hospitals.
Great resource.
And then also they have these practical guides too, right?
Yes.
On managing medications
That's right.
and preventing falls while you're in the hospital.
Excellent choices.
Yep.
Both of those are really known for giving clear, actionable advice.
That's our mission today, right?
Yes.
To pull out the most useful tips for someone like you
Absolutely.
who's concerned about staying safe during a hospital visit,
Yeah.
especially if you're a senior, right? We want to give you the tools to be your own advocate.
I love that approach. It can feel so overwhelming to be a patient. So knowing what to expect and how to participate in your own care is so powerful.
Let's start with medication safety.
Okay.
HealthWise really emphasizes patient involvement. It might seem obvious, but when you're in a hospital setting, it's easy to slip into that passive role, right?
Yeah.
So they have some really practical advice on how to prevent medication errors.
Yeah, it's so important. And one startling statistic that always kind of sticks with me is that adverse drug events that's harm caused by medications are one of the leading causes of death in hospitalized patients.
Oh,
So,
that's scary. So what can we do?
well,
HealthWise says that first step is making a list of all your medications before you even go to the hospital.
that's a great first step.
And not just prescriptions,
Right.
but over-the-counter meds, vitamins, herbal supplements, the works, right?
Yeah.
Bring a few copies of that list with you and make sure your nurses have a copy too.
Having that list is absolutely key. It helps everyone stay on the same page, especially if you're seeing multiple doctors or specialists. And while you're in the hospital, don't be shy about speaking up. Check your wristband every time to make sure it correctly lists your allergies.
That's such a good point. I know hospitals have systems in place, but it's good to have that extra layer of vigilance, right?
Absolutely. And when they're about to give you medicine, even if the nurse doesn't ask, state your full name and birth date, it's a simple way to confirm they've got the right patient.
It sounds so basic, but in a busy hospital setting, those little things can make a huge difference.
They really can. And don't be afraid to ask questions about each medicine. Why are you taking it? What are the potential side effects? What should you watch out for?
That reminds me of AHRQ's tip #4 about educating patients on using blood thinners safely.
Mm-hmm.
They can be essential after surgery to prevent blood clots,
Yeah,
but they also come with risks.
definitely. Blood thinners can interact with other medications, and there are specific things you need to know about taking them safely.
Right.
AHRQ actually has some great resources to help patients understand those risks and benefits. Like they have a short video and a booklet that you can download for free.
Now, armed with all this knowledge from HealthWise, let's see what additional insights we can glean from AHRQ's 10 tips.
Sounds good.
One that stands out to me is tip #3,
Okay.
which is about preventing venous thromboembolism,
Uh-huh.
or VTE.
So VTE is a blood clot that forms in a vein, and it can be very dangerous, especially for older adults who are already at higher risk.
Oh, wow.
The good news is that hospitals are very aware of this risk, and they have protocols in place to prevent VTE. They might prescribe blood thinners, encourage early mobility after surgery, or use compression stockings to improve blood flow.
So being aware of VTE and knowing that there are preventive measures in place can give you some peace of mind, right?
Exactly. And this leads to another crucial point, which is the importance of medication reconciliation before discharge.
That sounds important. Can you tell us more about what that is?
It's basically a thorough review of all the medications you were taking before you went into the hospital, what you took during your stay, and what you'll need to take when you go home.
Okay.
This is where having that initial medication list you created is super helpful.
Makes sense. It prevents any mix-ups or oversights as you transition back to your normal routine.
Right. A member of the hospital staff should go over all the details with you. Names of the medications, dosages, how often to take them, and potential side effects. This is your opportunity to ask any questions and make sure you're completely clear on how to manage your medications once you're back home. It's also a chance to double-check that there aren't any potential interactions between your new medications and anything you were taking before.
So medication reconciliation is like a safety net, right?
Exactly.
So everything is coordinated,
Yeah,
and you're not going home with a confusing or potentially dangerous mix of pills.
exactly. And speaking of safety nets, let's move on to another big concern, especially for older adults in the hospital.
Falls.
Right.
Yeah.
HealthWise has some excellent advice on this. And it all starts with awareness.
Yeah.
The hospital environment can be disorienting, right?
Absolutely.
You're in a new place, you might not be feeling your best,
Right.
and there are all sorts of potential hazards around. Right. And the statistics on falls in hospitals are pretty alarming.
Oh, really?
Studies show that falls are the most common type of adverse event in hospitals,
Oh, wow.
and they can lead to serious injuries, especially in older patients.
That's a good reminder to be extra cautious.
Yeah.
What are some specific steps we can take?
Well, HealthWise suggests packing some practical items that can help prevent falls,
Okay.
like non-skid footwear or slippers.
Okay.
And if you use a walker or cane at home, definitely bring those with you.
Good idea.
The hospital can also provide assistive devices if needed.
So it's all about being prepared and setting yourself up for success.
Right, exactly. And once you're there, communication is key.
Okay.
Don't be afraid to ask for help getting out of bed or going to the bathroom, even if you feel like you can manage on your own.
Right.
It's better to err on the side of caution.
And let your nurse know if any medications are making you feel dizzy or lightheaded.
Oh, yeah, for sure.
Those can be big risk factors for falls.
Speaking of the hospital room, HealthWise gives some excellent tips for making that environment safer.
Okay.
For example, ask to have your bed lowered if it's too high for you to get in and out of comfortably.
That makes a lot of sense. I can see how a high bed could be a recipe for a fall, especially if you're not feeling steady on your feet.
Absolutely. And make sure the call button is within easy reach.
Right?
You don't want to have to strain or reach across the bed to call for help.
Keep the pathway to the bathroom clear of clutter and obstacles, too.
Yes, good lighting is crucial,
Okay.
both during the day and at night. If you wear glasses, make sure you have them on whenever you get out of bed. And if you notice any spills or hazards in your room, don't hesitate to point them out to the staff.
All of this reinforces the idea that you're an active participant in your own safety, right?
Yeah.
You're not just a passive recipient of care.
Exactly. Your awareness and willingness to speak up can make a real difference. And this connects nicely with AHRQ's tip #7,
Okay.
which is about the role of hospital design in patient safety.
They're talking about how the physical layout of the hospital
Yes.
can actually impact patient safety.
Yes. For example, single bedrooms can help reduce the spread of infections. And having decentralized nurses' stations means nurses are closer to their patients and can respond more quickly to calls for help.
So it's not just about what happens inside your room. It's about the overall environment.
Right. And that environment also includes the culture of safety within the hospital. That's something AHRQ highlights in tip #8.
What exactly do they mean by patient safety culture? I'm not sure I understand that concept.
It's about creating an atmosphere where everyone, doctors, nurses, staff, and even patients are committed to preventing errors and improving care. It's about open communication, a willingness to learn from mistakes, and a shared sense of responsibility for patient well-being.
So it's about creating a climate where people feel comfortable speaking up about concerns.
Yes.
And potential safety hazards.
Exactly. And hospitals can actually measure patient safety culture using surveys
Oh, really?
that ask staff about things like how safe they feel the environment is, how well they communicate with each other, and whether they feel comfortable reporting errors or near misses.
It sounds like those surveys could be really valuable for identifying areas where improvements can be made.
They absolutely can. Because if staff don't feel safe speaking up about concerns, or if they don't feel like their input is valued, that can create a breeding ground for errors.
It makes you realize that a strong patient safety culture isn't just some abstract idea.
Right.
It has a direct impact on the quality of care patients receive.
Absolutely. And you, as the patient, are a part of that culture. Your willingness to ask questions, voice concerns, and advocate for your own safety contributes to a stronger safety culture for everyone.
It's empowering to think that we're not just along for the ride, right?
Yeah.
We can actively shape the environment and the culture of care. So we've talked about medication safety, fall prevention, and the importance of a strong patient safety culture. Are there any other tips from AHRQ that are particularly relevant for older adults?
Definitely. Tip #2, which focuses on re-engineering hospital discharges to reduce readmissions, is especially important for seniors.
Why is that?
Well, after a hospital stay, older patients are often more vulnerable and may need more support to manage their medications, follow-up appointments, and any new health challenges that have arisen.
So a well-planned discharge is crucial to prevent them from ending up back in the hospital soon after they've been released.
Exactly. Clear communication during discharge planning is essential. Make sure you understand your medication schedule, when and where your follow-up appointments are, and who to call if you have any questions or concerns once you're home. Don't be afraid to ask for clarification if anything is unclear.
It's like having a roadmap for what to expect and how to navigate those first few days and weeks after you leave the hospital.
That's a great way to think about it. And remember, your family and caregivers can also play a crucial role in advocating for your needs and helping you manage your recovery.
It's a team effort, really.
Yeah.
Everyone working together to ensure the best possible outcome.
Speaking of teamwork, there's one last AHRQ tip that I think deserves a mention.
Okay.
And that's tip #1, which focuses on preventing central line-associated bloodstream infections, or CLABSIs.
I have to admit I'm not familiar with that term.
Okay.
What exactly are CLABSIs?
A central line is a type of catheter that's inserted into a large vein, often in the neck, chest, or groin.
Okay.
It's used to deliver fluids, medications, or blood products directly into the bloodstream.
I can see how that would be necessary in certain situations.
Exactly. But unfortunately, central lines can also be a pathway for bacteria to enter the bloodstream, which can lead to serious infections.
Oh.
These infections, called CLABSIs, can be life-threatening, especially for older adults who may have weaker immune systems.
So how do hospitals prevent these infections?
They have strict protocols in place for inserting and maintaining central lines.
Okay.
These protocols involve using sterile techniques, cleaning the insertion site regularly, and changing the dressing as needed.
It sounds like there's a lot of attention to detail involved.
There is, and that's a good thing.
Yeah.
Because it shows how seriously hospitals take the risk of CLABSIs.
So as a patient, what can we do?
If you have a central line, make sure to ask your healthcare providers about the steps they're taking to prevent infection. Don't be afraid to speak up if you have any concerns or if you notice anything that seems amiss.
It's about being informed and being an active participant in your care.
Exactly. And now, to shift gears a bit, let's move beyond the hospital walls and talk about something really important. What steps you can take before a hospitalization to prepare and ensure the best possible outcome.
That's a great point. We've focused a lot on what happens during a hospital stay, but there's a lot you can do beforehand to set yourself up for success. What are some practical steps we can take?
Well, one of the most important things you can do is get all your medical records in order.
Okay.
That includes a list of all your medications, allergies, past surgeries, and any chronic conditions you have.
Okay.
Think of it as creating a comprehensive health profile that you can easily share with your healthcare team.
So it's like that detailed medication list we talked about earlier,
Exactly.
but on a larger scale.
Exactly. You want to have all that information readily available in case of an emergency or if you're admitted to the hospital unexpectedly.
Right.
And speaking of being prepared for the unexpected, make sure your advance directives are in order.
That's something people often put off.
Yeah.
But it's so crucial, especially as we get older.
It really is.
Yeah.
Advance directives, like a living will or a durable power of attorney for healthcare, ensure that your wishes are respected if you're unable to communicate them yourself.
It gives you peace of mind knowing that your loved ones
Yeah.
and your healthcare providers will be guided by your decisions.
Absolutely. And on a more practical level, think about the logistics of getting to and from the hospital. Will you need someone to drive you? Who will be your primary contact person?
Those are important details that can easily slip your mind when you're focused on the medical stuff.
It's helpful to have a plan in place so you're not scrambling at the last minute.
Right.
And if you have some time to prepare, packing a bag with essentials can make your hospital stay a little more comfortable.
What kind of things should we pack?
Comfortable clothes,
Right.
non-skid slippers, toiletries,
Right.
any assistive devices you might need,
Okay.
like a walker or cane. And don't forget your phone charger.
Of course.
Hospitals can be boring places,
Yeah, they can.
so bring a book or magazine to keep yourself entertained.
Those are all great tips. It sounds like being prepared for a hospital stay is a multifaceted process, right?
Yeah.
It's not just about gathering your medical information, but also about thinking through the practical and logistical details.
You've got it. It's about being proactive and taking charge of your healthcare journey.
And remember, both AHRQ and HealthWise have fantastic resources that you can access for free.
Yes, they do.
We'll be sure to include those links in the show notes so you can dive deeper into these topics.
Excellent idea.
So, to wrap up our deep dive into hospital safety, especially for older adults, let's recap the key takeaways.
Sounds good. It's always helpful to summarize the main points.
We started by talking about the importance of medication safety
Yeah.
and learned some really concrete steps you can take to prevent errors, both before and during your hospital stay.
Like making a detailed list of all your medications and supplements.
Right.
Checking your wristband, asking questions about each medicine you're given, and understanding why changes are made.
Right. It's all about being proactive and involved in your own care. And we can't forget about medication reconciliation before discharge.
Oh, that's so important.
That's crucial to avoid any confusion or problems once you're back home.
Absolutely. A smooth transition back to your regular routine is essential.
Then we moved on to fall prevention, another major concern for older adults in the hospital.
Right.
We talked about practical things like wearing non-skid footwear, using assistive devices, asking for help when you need it,
Yeah.
and making sure your room is safe.
And remember, communication is key here.
Right.
Let your nurses know if you're feeling dizzy or weak, and don't hesitate to ask for assistance getting out of bed or going to the bathroom.
We also talked about the importance of a strong patient safety culture,
Yes.
which means creating an environment where everyone is committed to preventing errors and improving care.
Hospitals can measure patient safety culture using surveys.
Right.
And they also have protocols in place to prevent serious infections, like those associated with central lines.
And we learned about the importance of planning ahead for a hospital stay, from getting your medical records in order to sorting out the logistics of transportation and communication.
It's all about being prepared and proactive.
And never underestimate the power of advocating for yourself.
Right.
You are your own best healthcare champion.
That's a great note to end on.
Thanks for joining us on this deep dive into hospital safety. Until next time, stay curious, stay informed, and stay safe.